the various serological markers related to viral hepatitis. Biological diagnosis of a particular disease or a particular infection can be categorized into two types of tests, that is direct and indirect tests. Indirect tests are basically host-based tests, or the host-mediated immunity. That is, we detect antibody in these type of tests, and these types of tests are more sensitive, and they primarily detect recent or the past infection. While in direct tests, we detect pathogen, or we can quantify or detect antigen or nucleic acid. These type of tests are more specific and tells about the active infection. Differentiate between acute and chronic infection. In layman language, acute infection is a period of inflammation or hepatocellular injury that lasts less than 6 months. It is mainly caused by hepatitis A and E viruses, but other viruses also shows acute infection. At the time of acute infection, immunoglobulin M is highly positive. While in case of chronic infection, it is the inflammation or hepatocellular injury that persists beyond a period of 6 months. It is mainly caused by hepatitis B and C viruses. Now, the markers for each and every hepatitis. Hepatitis A markers are IgG anti-HAV. That means it can be due to the past exposure to HAV, hepatitis A virus, or it can be due to the vaccination or the immunity developed due to the vaccination. IgM anti-HAV antibody test means it is due to the recent infection, and total antibody test is also tested with detect and IgM anti-HAV and IgG anti-HAV. Hepatitis B is a spherical and double-shelled structure of approximately 542 nanometer in diameter, having a lipid biomembrane consisting of a hepatitis B surface antigen, which surrounds the nucleocapsid, that is the core antigen, which is complex with the DNA polymerase and the genomic material, that is HBV DNA, that is partially double stranded DNA of approximately 3.2 kb. Now, in this type of hepatitis B markers, we test antigen, antibody, and HBV DNA. Means indirect and direct tests are done. For hepatitis B surface antigen, anti-HBs titer is being done, or antibody against hepatitis B surface antigen is seen. It can be due to the infection exposure of a person to a hepatitis B virus, or it can be due to the vaccination in an individual. Hepatitis C core antigen, it does not appear in blood, it appears in the nucleus of an infected cell. So it cannot be detected, it is not clinically tested. So antibody against it, IgM anti-HBC for recent infection and total anti-HBC for past and recent infections can be seen, can be tested. HBeAg, that is the E antigen, antibody against it is anti-HBe. It denotes the high viral replication. Apart from these antigen and an antibody, HBV DNA can be qualitatively and quantitatively detected, which are the active markers and are used to decide the need of antiviral drugs. Markers for HCV, anti-HCV, it means a person has been exposed, so it remains positive even after a resolved infection in an individual or the patient that has taken a successful treatment. These antibodies remain active for approximately 20 years. HCV core antigen, it is found when the infection is active. So the viral protein produced only when the virus is replicating. It can be a good alternative to HCV RNA because it is much cheaper and easy to do technique. It becomes negative after the successful treatment. Apart from core antigen and anti-HCV, HCV RNA quantitatively and qualitatively can be detected using real-time PCR. HCV genotyping is being done. Hepatitis C has 1 to 6 genotypes. The sequence variation can lead to varies in sensitivity to some drugs. So it can be helpful in deciding an appropriate treatment in some situations. Hepatitis B virus require hepatitis B virus for its replication. HBsAg positive patients show a close contact with hepatitis B virus patients. HDV infections occurs when it can be due to the co-infection, when HBV and HDV virus simultaneously infect an individual, while superinfection is when a person is having an hepatitis B infection priorly and he gets infected to hepatitis D. For hepatitis D viruses, we mainly detect total anti-HDV antibodies, that is IgM and IgG, for recent and past infection respectively. Apart from that, HDV RNA is tested in few cases, but it is not widely used technique because there is no standardization of HDV virus assay. For HEV virus, IgM, that is for the recent infection antibodies, are being tested. HEV virus actually shows an acute infection, so these antibodies last for within 6 months of period, while anti-HEV IgG is also tested for those individuals that have been exposed to an infection. Apart from that, HEV RNA is also being tested. In some cases, HEV antigen is also tested. So how do you test the sensitivity and specificity of an assay? A sensitivity of an assay is said to be 100% when all the individuals, for example, if you are having 50 individuals that are having hepatitis C infection, so all of them are tested positive. That is true positive result, and the assay does not give a false negative result. It is said to be 100% sensitive. While assay is said to be 100% specific if all the individuals that have no condition or they are healthy. That is a true negative. An assay that gives all the true negative results and does not give a false positive result. It means the assay is 100% specific. Proportion of those who are tested positive determines the positive predictive value, and the screening tests that give proportion of those who give the negative results are set for determining the negative predictive value. An overview of all the tests that we usually do for detecting all the viral hepatitis J is: for hepatitis A, anti-HAV antibody indirect based tests are done. For hepatitis B, antigen, antibody, and nucleic acid tests are being done. For hepatitis C, antibody, antigen, and nucleic acid tests are done. Apart from that, genotyping is done for some drug-based treatment. Hepatitis D, antibody tests are mainly done, not nucleic acid, they are not available. For HEV test, we usually detect antibodies for the past of the recent infection and the nucleic acid detection for the active infection. Thank you.